What is anxiety? Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. For example, going to a job interview or giving a speech on the first day of school may cause some people to feel fearful and nervous. But if your feelings of anxiety are extreme, last for at least 6 months, and are interfering with your life, you may have an anxiety disorder. What are anxiety disorders? It's normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and do a better job. Ordinary anxiety is a feeling that comes and goes but doesn't interfere with your everyday life. In the case of an anxiety disorder, the feeling of fear may be with you all the time. It's intense and sometimes debilitating. This type of anxiety may cause you to stop doing things you enjoy. For example, it may prevent you from entering an elevator, crossing the street, or even leaving your home in extreme cases. If left untreated, the anxiety will keep getting worse. What are the types of anxiety disorders? Anxiety is a vital part of several different disorders. These include panic disorder. This means you experience recurring panic attacks at unexpected times. Phobia. This is an excessive fear of a specific object, situation, or activity. Social anxiety disorder. This is an extreme fear of being judged by others in social situations. Obsessive-compulsive disorder. This means you have recurring irrational thoughts that lead you to perform specific, repeated behaviors. Separation anxiety disorder. This means you have a fear of being away from home or your loved ones. Illness anxiety disorder. This is anxiety about your health. Symptoms. Trusted source of anxiety can include anxious thoughts or beliefs that are difficult to control, restlessness, trouble concentrating, difficulty falling asleep, fatigue, irritability, unexplained aches and pains. Medication. Doctors prescribe anti-anxiety and antidepressant drugs. Meeting with a therapist or psychologist can help you learn tools to use and strategies to cope with stress when it occurs. The Mental Health Resources page can provide tips on finding a psychiatrist or a doctor who specializes in mental health to fit your needs. Medications typically used to treat anxiety include benzodiazepines for short-term symptom relief, but they're avoided if possible due to the high risk of dependence. Other anti-anxiety or antidepressant medications such as escitalopram effectively alter your brain chemistry to improve mood and reduce stress. Teenagers may have many reasons to be anxious. Tests, college visits, and first dates all pop up in these important years. Symptoms of anxiety in teenagers may include nervousness, shyness, isolationist behaviors, and avoidance. Likewise, anxiety in teens may lead to unusual behaviors. For example, they may act out, perform poorly in school, skip social events, and even engage in substance or alcohol use. In some teens, depression may accompany anxiety. Diagnosing both conditions is essential so that their treatment can address the underlying issues and help relieve symptoms. The most common treatments for anxiety in teenagers are talk therapy and medication.